Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about heart disease and heart transplant. A heart transplant involves swapping out a patient's unhealthy heart for a healthy heart from a donor. The deceased person is the donor, and their family has given permission for them to donate their loved one's organs. Heart transplantation has evolved from an experimental procedure to an accepted treatment for severe heart disease in the more than 40 years since the first human heart transplant was carried out in 1967. In the United States, more than 2,000 heart transplants are carried out annually. If there were more hearts available for donation, hundreds more people a year would gain from heart transplants. The purpose of heart transplantation. When heart failure is so severe that it does not improve with other treatments but the patient is otherwise healthy, a heart transplant is considered. The following conditions are the main causes of heart transplantation. Dilated cardiomyopathy, a heart attack-related condition marked by severe coronary artery disease and damaged heart muscle. It is significant to highlight that there have been numerous new developments in the treatment of heart failure, including new pacemakers, medicines, and surgical procedures. It's crucial to get your condition evaluated by a physician who specializes in heart failure while deciding on your treatment options. Who qualifies as a heart transplant candidate? People who are otherwise healthy but have advanced, end-stage, heart failure may be given consideration for a heart transplant. You, your doctor, and your family should think about the following fundamental inquiries to decide whether a heart transplant is the best option for you. Have all alternative treatments been explored or ruled out? Are you going to die if you don't get the transplant? Apart from the heart or heart and lung illness, are you in generally good health? Can you maintain the lifestyle modifications needed following a transplant, such as difficult pharmacological treatments and regular exams? A heart transplant might not be for you if you provided a no response to any of the aforementioned questions. You will also probably not be considered a candidate for transplant if you have additional medical issues, such as other severe diseases, active infections, or significant obesity. What steps are involved in receiving a heart transplant? You must be added to a transplant list in order to be considered for a heart transplant. However, you must undergo a thorough screening procedure before being added to the transplant waiting list. The results of your medical history, diagnostic test results, social history, and psychological test results are reviewed by a team of heart doctors, nurses, social workers, and bioethicists to determine whether you will be able to survive the procedure and adhere to the ongoing care required to live a long, healthy life. You must wait for a donor to become available after being given the go-ahead. It may take a while and be stressful. You will need a strong network of relatives and friends to assist you through this difficult time. To keep your heart failure under control, the medical staff will continuously monitor you. In the event that a heart becomes available, the hospital must always be able to reach you. How are heart transplant organ donors found? The people who donate their hearts may have just passed away or have become brain dead, which means that while their bodies are being kept alive by technology, their brains show no signs of life. These donors frequently passed away following a car accident, serious head injury, or gunshot wound. Before passing away, donors provide their consent to donate their organs. At the time of death, the donor's family must also grant their approval. The United Network for Organ Sharing, UNO's computerized nationwide waiting list is used to locate donor organs. When organs become available, this waiting list ensures equitable allocation and equal access. Depending on blood type, body size, UNO's status, based on the recipient's medical condition, and length of waiting, a heart is given to the recipient who is the best match when one becomes available for transplantation. The match is unaffected by the donor's race or gender. Human immunodeficiency virus, HIV, and hepatitis B and C testing are performed on all donors, HIV. There aren't enough hearts available for transplant, unfortunately. Approximately 3,500 to 4,000 patients are in the waiting list for a heart or heart-lung transplant at any given moment. More than 25% of people do not survive long enough to receive a transplant, and they may wait months for one. Since they are aware that someone must pass away before an organ becomes available, Many persons who are in the transplant waiting process experience conflicted emotions. It can be comforting to know that many donor families experience peace in knowing that something positive has resulted from the passing of their loved one. What takes place throughout a heart transplant? When a heart from a suitable donor becomes available, a transplant center surgeon physically removes the heart from the donor. While being transported to the recipient, the heart is chilled and kept in a specific solution. Before starting the transplant procedure, the surgeon will make sure the donor heart is in good condition. The donor heart will be made available as soon as feasible after the transplant surgery. The patient is attached to a heart-lung machine throughout the procedure. This device makes it possible for the body to obtain nutrients and oxygen from the blood while the heart is being operated on. The patient's heart is then removed by the surgeons, save for the rear walls of the atria, the heart's upper chambers. The donor heart's rear atria are opened, and the heart is then stitched into position. The blood vessels are then connected by surgeons, allowing blood to circulate through the heart and lungs. The heart starts to beat when it gets warm. Before detaching the patient from the heart-lung machine, surgeons inspect all the associated blood arteries and heart chambers for leakage. It is a challenging procedure that takes 4 to 10 hours to complete. The majority of patients are up and moving around within a few days of surgery, and if there are no indications that the body is rejecting the organ right away, patients can return home in 7 to 16 days. What risks are inherent with heart transplants? Infection and rejection are the most frequent factors leading to transplant-related death. Patients who use medications to prevent transplant rejection are at risk for renal damage, high blood pressure, osteoporosis, a serious bone weakening that can cause fractures, and lymphoma, a type of cancer that affects cells of the immune system. Nearly half of transplant recipients develop coronary artery disease. Many of them also don't exhibit symptoms like angina because their donor hearts aren't feeling anything. What is rejection of organs? The immune system normally defends the body against infection. Immune system cells search the body for anything that appears alien or different from the body's own cells as they move about. When the body's immune cells identify the transplanted heart as unique from the rest of the body and make an effort to eliminate it, rejection happens. If a donor heart were left unattended, the immune system would deteriorate its cells and finally destroy it. Patients are given a variety of medications known as immunosuppressants to avoid rejection. These medications inhibit the immune system to prevent injury to the donor heart. Immunosuppressive medications are administered to patients the day before their transplant and continue to be provided to them for the rest of their lives because rejection might happen at any time following a transplant. Heart transplant recipients must closely follow their immunosuppressant medication schedule to prevent rejection. Researchers are constantly developing immunosuppressant medications that are safer, more efficient, and well tolerated. However, severe infections can result from excessive immunosuppression. A patient is more likely to get severe infections if their immune system is not sufficiently active. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.